Wash my head. That's first things first. We already know I'm wavy, so I ain't gonna even touch on that. Y'all know that. That ain't nothing new, y'all. I'm too. What we represent, man?
Big money bound.
So let her know, man.
Big money bound.
The kids, man. We got the kids, man. Big Money Bound TV. Hold on. Let's try that again. Big Money Bound TV. RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Like I told y'all, man, they done had me in the ER for the last 10 days, and this made the 11th day. I've been working ER, man, a lot. But hey, I'm thankful and I'm blessed. I'm glad I can work the ER. Because everybody can't work the ER. It's not like they can't do it. It's just like a comfort level. So if you're not too used to it, you haven't done it too many times, you may just be like kind of stuck in your ways, or you don't really care about learning to work down there, or you may just be like, you may not think you're ready for it, but bro, it's respiratory therapy. You up there, you down here, you doing respiratory therapy regardless of where you at. So my supervisor had called me today, the daytime supervisor. He was like, hey, you want to come into work today? You want to come into work? Whenever you hear that and you already scheduled, you know it's crazy. I'm already on the schedule, yet you still calling me? Bro, I'm on the schedule. Okay, sorry, man, have a good day. I'm in ER, to put me in ER, because, bro, y'all already know. He calling me saying, do you want to come to work when I'm already on the schedule? That means it's crazy busy. So, put me in that ER. Well, it's not no guarantee if it's going to be busy or not. You gotta roll that dice, you feel me? You gotta roll that dice, man. So, I rolled that dice, dog. And I rolled that dice, man. And it was oh so nice. But before I get to that, I get to my department, y'all know I gotta get my scrubs first. I go down and I get my scrubs, put my scrub game on. You know, COVID is still real. I'm still scared. I don't know about nobody else. Ain't nobody else scared, but I'm still precautious, man. So I put on my scrubs, come upstairs, call the person that's in the ER. I'm like, hey man, you want me to come down to the ER, or are you able to come up? Oh, I'll be out there. Just give me some time. I had to transport this ventilated patient from the ER to the unit. Hey, thank you for doing that. I appreciate all that support, because they could have left that behind for me. But yet, they chose to go ahead and transport that and not leave it behind for me. Thank you. That's what you call teamwork. So, I'm down there waiting for dog. I'm waiting. Oh, you gotta pull us. It's a bug here. Hold on, it's a bug here. Hold on. Speaking of bugs in here, bro, I come to my car. It's like cat fur on my car, bro. Like a cat been on my car, man. I don't know why people at the hospital in the parking garage feeding cats. Feeding stray cats. Like, bro, I'm all for, support the animals, Peter, keep your thing up. Hey, don't be up here, bro. You gonna make the damn garage the cat's home. They gonna be waiting for the food. So they sit around in cars waiting for somebody to come feed them. Bro, I was gonna tell y'all too much. I was gonna tell y'all I'm afraid of cats. But I ain't gonna get that personal. I ain't gonna tell y'all I'm afraid of cats. No, I ain't gonna go there. So I'm waiting for the ER person to come up, man. They finally come up. They telling me, yeah, man, I had a great day. Hopefully you have a great night. As they talking to me, the phone go off. Page will go off. They're like, what's going on? What happened? I had a good night. Don't start all that beeping. It was an ABG. So I'm like, all right, man, thanks for the report. Let me go down to the ER and take out this ABG. I get down to the ER. I got all my gowns on, my mask, my face shield, my goggles, all that, man. Going to the patient room. Patient kind of like very lethargic, man. Like not with the program. Kind of like woozy. And kind of like every now and then moving the wrist. Now, and the other wrist is like bandaged up. Like it was like a sprained wrist or something. I gotta get this right here. I gotta get ABG. You ain't doing that. You just like kind of, you feel me? You just probably uncontrollable muscle spasms. I don't know. You just feel me? You just doing your thing. I gotta get ABG. Family member in the room telling me, "Oh, you gotta draw some blood." Yeah, he may jump when you stick him. All right, so now I can't be in there doing my ABG. Now I can't do that. I gotta hold that hand. I got to, so he don't jump if needle don't hit me. Gotta hold your hand and use my other hand as I'm holding it to draw the ABG. But like I said, when doing that, you gotta find your landmark. First thing first, you gotta find out where it's at. Where you feel the arterial post at. First things first. So anybody that's having trouble ABGs, I'm giving you a little sneak peek. I'm giving you a little something. You gotta find the post. Bam, bam. We right there. Bam, we right there. Okay, we right there now. Oh yeah, right there. Okay, bam. You see it's a line, right? It's a vein right here. So it's to the right of that, right here. It's up and to the right of that. Not on this knot though. Right here. Okay, so with the patient skin though, it was like, if anybody know what this is called, please drop the comment down below. It's slipping my mind right now. But when you push a patient's skin and it leaves an indentation, it leaves an indent in the skin and it takes a while for it to like come back. You push it and it leaves like a little dent in there for a while, then it starts to come back. That's what was going on with the patient. So once I put my hand on where the arterial post was the most palpable, I felt it the most. I got up and I saw an indent. Okay, let me do that again. So I did that, got my indent. I tell you no lie, man. Right there, bingo. As soon as this needle hit the skin, blood went shooting back. Hey, man. The family member like, "Oh my gosh, you're very good." Hey, I live this life, dog. I live it. I would say, yeah, I'm a healthcare professional. No problem, I'm a professional. My dog was lethargic. ABG was fine. Like normal. Everything normal. The family member was saying that the nurse said she'll give him some sleeping meds at like home or something, home care or something. I'm like, okay. Give him like some sedation or something. Cause dog ABG was fine, so took care of that. Everything was smooth. And I guess somebody had used a code box, a certain code box, and they didn't put it back on day shift. So I had the charge nurse run up on me. "Oh yeah, we need a code box." He said, "Hey, bro, hey man, like let's just be like, you feel me? Like, hey, how you doing? I got a quick question for you. You want to go to it's manners, bro. Just have some manners. Let's do ethics, man." I'm like, "All right, man, you have a good night. Are you leaving? Are you leaving?" "No, I'm just trying to be like polite as I depart from you. That's all, man. I ain't trying to keep this rudeness going. You feel me? Let's just have some manners, dog, man." So I got what I got a call for? Conscious sedation. I don't know what happened to this person's shoulder, but somehow the shoulder had popped out, and like it was up here. Like this here was up here, like that bone, that joint piece that's in there, that's in that cuff. It was poking up here, bro. When they putting these joints and these bones and these things back in place, it ain't nothing. It ain't no smooth transition. I tell you no lie, man. Y'all know somebody like they be in PE class and they climb up a rope. They like pulling up a rope. Bro, I seen somebody grab somebody arm and like try to pull up, like they're gonna pull it up. Bro, hey, dog. And all I'm doing is witnessing this. I'm witnessing it. Hook the patient up to the CO2 detector. Make sure that they still ventilating while they sedated. And how you do that? As long as you see the end-tidal CO2 isn't climbing. It ain't going like 35, 40, 45, 50. That means no CO2 has been blown up. So you see 30, 29, 28, 27, 30, 31, 32, and they keep fluctuating between those, you good. You see it's CO2 being blown off. But if we just keep going up and up and up, that means we're not ventilating. So I'm keeping an eye on that. Got my ambu bag ready just in case. I've never had to use it, but I'm still ready just in case I have to. Dog, they on the patient arm like, bro, hey. And they want to tell me, hey, you hold this out here. Hey, I don't want to be involved in that, dog. I'm joking. Whatever the doc say, hold, like, you gotta just be helpful first and person. Like, doctor want to give you like a medical order, just hold this here. Hey, say less, dog. Hold on, I got you, dog. So I'm helping out. We finally got it though. So hey, everything was good, man. I had to draw another ABG. I hate drawing ABGs on like younger people, even people in their 20s. Because not like a person in their 20s don't get sick, but you know, like, your health supposed to decline as you get older. You feel me? That's like, I don't want to be drawing, bro. Somebody 20, 21, like, bro, you feel me? 19, 17, 12, 13, 14. I don't want to, but hey, I gotta do it. You feel me? I gotta do it, man. Like, I don't want to be. How can I put this, man? Like, you know how, like, when somebody is sick, they're kind of at their lowest point. Man, I want certain people to see them or whatever. But I'm a respiratory therapist in the hospital. Like, I don't want to see you while you're sick. If I know you don't want to see you while you like this book, but I'm a respiratory therapist. Like, that's what I gotta do. I don't want to see you sick, but it's how I eat. Feel me? If that makes sense, I don't know if it does. So I did that. I did that ABG. Dog told me, yeah, man, I know you gotta do what you gotta do, but last time I had that ABG done, my whole arm was like hurting for a whole 2 weeks. When I put my arm straight, it was like hurt, like heck. It was like it's been radiating pain up my arm. I'm like, bro, hey, I ain't never heard of them side effects, man. Hopefully that don't happen this time. I'm a healthcare professional. I've done this a million times today. You're in good hands. Or yeah, I'm not saying I don't want you to do it. I'm just saying, like, man, it was just hurting for like weeks. I'm like, yeah, I feel you, bro. Dog say I lift my arm up, pain shoot up. I ain't never heard that. Hey, y'all ever heard something like that? Dog say, I'm like, oh, what they did the shot? And he like, no, my whole arm. All right, can y'all explain that to me in them comments? Please explain that to me, because I don't know what dog was talking about. Then the last thing for the night, man. There's always something with this COVID, bro. They called me, said, yeah, man. Patient needs a breathing treatment. You feel me? They finna go back to their room soon. They need a breathing treatment. They just came to the ER. So what's the COVID status? Oh, I'll say we ain't doing that no more. All right, come on, dog. Come on, man. We ain't doing COVID testing no more. That's what you're telling me? The physician said that the patient doesn't need it. She just wants you to come get a treatment. I'm on the phone like, yeah, bro, but like, I need it for like my safety. I'm like, yeah, you know what? I'll be over there, man. Because it's like, bro, especially now with what's going on, like, you know, you get you can feel like an energy level, like, it's a certain vibe in the hospital that's going on with, bro. People just getting like write-ups for this and that. People getting like names getting red flag, calling to the office, going to the HR. It's just like too much crazy stuff. So it's like, bro, before I even put myself in that line of fire, I'm gonna protect myself to the utmost. Once I turn this breathing treatment on, y'all be careful, man. I don't want to do it, but they putting in the orders. I go talk to the doctor. Like, do you want me to wait for the COVID? Say, oh no, we don't got time to wait. The patient's having shortness of breath, retractions, all this. I look at the patient, they're doing fine. I got you, dog. Say less, man. Say less, bro. I double check with everybody. Nurses, doctors. Yeah? Alright now. Y'all look out. Y'all look out, dog. Y'all don't want to wait for no COVID test. We look out. I'm following orders. And I ain't just doing it. Not letting you know. I'm saying, I'm finna turn this on now. I recommend nobody come in here while it's gone and 30 minutes after it's done. That's just my recommendation. Each his own. And I'm out of here, thug. I'm out, man. Y'all be easy, dog. Boy, I'm grinding, dog. I'm grinding, man. And I ain't even really been like, I ain't picked up no overtime this whole 2 weeks. I ain't did that. Oh, you know what? Yes, I did. Yes, I did. I picked up like, it's like overtime without picking up overtime, if that makes sense. But I'm going to explain. It's like you getting paid, you getting extra hours, you getting your hours, but you're not working. Man, how the hell you, hey, keep post notifications turned on. I'm going to do that video about things you could be doing to earn extra money at your job. I'm going to give you all the secrets, all the ins and outs of it. But until then, y'all stay safe, be easy. Keep your mask on, stay your ass home.